Get Tested week starts December 1st. So if you're doing it, do the right thing. Call 866-EXAM-HIV. That's 866-EXAM-HIV. HIV. Live with it. Get tested. Want to be free from HIV? PrEP can help. Taken daily and with other preventative measures like using protection and regular testing, it can reduce your risk of getting HIV by over 90%. Love free HIV with PrEP. Learn more at michigan.gov/HIV-STD.
Most people think that depression is just sadness, but in reality, there are many factors that contribute to it. People feel hopeless, self-loathe, isolated, stressed, anxious, emotionless, and guilty. When people have depression, it inhibits them from functioning on a day-to-day basis. Depression is a real disorder. So the next time that you think someone with depression is overreacting, think again. Stuck in reverse.
Playing a little something different today, you guys. It's by a young man by the name of TerryHBK. You can find him on iCloud, Spotify, and YouTube.
You know, every day I'm just trying to take it day by day, moment by moment, second by second.
I would never switch up, I would never go. I was taught to huddle up when getting cold.
It's called Thank You.
Life showed me never ever trust a soul.
Come on in, you guys. Come on in.
That's why I keep my circle hella small, though. That's why I stopped texting people randomly. Past month I'm at my all-time low. But I'ma keep my head up, got them things low. I can feel it, I can see it on my dress progressing.
Got a really amazing guest today.
They had to pay to show you how to have your own reflection. Sit back with me, humble my nigga, keep up all your blessings. In the trenches, let me your mate. Find with my brothers, I'll take. You ain't even hearing I hate. Counting on me while leave you waiting.
Great Sunday, Lily. Great Sunday, sis.
I would never switch up, I would never go. I was taught to huddle up or getting cold. But life showed me never ever trust a soul. Same person getting played, we call them bro. That's why I keep my circle hella small, bro. That's why I stopped texting people.
Maria Mahia says, hi, Warren.
But I'ma keep my head up, got them thankful.
Y'all share this live. Can't wait to hear what Warren got to say.
I would never switch up, I would never go. I was taught to huddle up or getting cold. But life showed me never.
And this is TerryHBK. You can find him on iCloud, Spotify, and YouTube.
That's why I stopped texting people randomly. Past month I'm at my all-time low. But I'ma keep my head up, got them thankful.
It's actually my nephew. He's been doing music for a long time. All right, you guys, happy day. This is Positively Dee discussion. You have to remember that HIV still exists. You have to get tested. You have to use protection. And if you have contracted HIV, you can get on medication and you can live a better, healthier life. Today, I have a guest on by the name of Warren O'Mary Dates. I hope I said that right. And we're just going to do some little chit chat like it's me and him, but he's an amazing man. And I could feel his soul, his energy, He's very humble. When you talk to somebody, you could feel the energy when they talk. So I'm gonna bring him on. You guys let me know if you can feel his great energy. I'm gonna bring him on right now. Hey, Warren.
Hey, Dee. What's up?
Good to have you. Good to have you.
I'm glad to be here tonight.
Tell everybody a little bit about Warren. We called this show Voices of Blacks and Women in Healthcare. But let's talk a little bit about Warren first, okay? Let us know a little bit about Warren, where he comes from, and how'd you get to this space today?
All right, well, I'm Warren O'Mara Dates, originally born and raised in Gadsden, Alabama. So I'm a Southern boy, Southern bred, and some folks say when I die, I'll be Southern dead. I'm a preacher, as well as an HIV activist and philanthropist. And so I'm 44 years old, married to a wonderful human being by the name of Kevin O'Mara Dates. And we just celebrated a couple months ago our 4th year anniversary. So I'm excited to have that love of my life. And we're doggy dads. Our baby's name is Maddie. She's a nine-year-old Dachshund hound. And so I split my time between Alabama and Georgia as a result of the non-traditional marriage that we have, but because of our careers, we have invested time over time. I'm by state in terms of how I live. But I'm just your average person, your friend, everybody's friend. Some folks say uncle. But yeah, I'm just an average Joe, just trying to make a difference every day.
Average Joe in the South. Average Joe in the South.
Yep.
Let's get down to some nitty gritty here, okay? Now, I watched the YouTube video with you, and it had me in tears.
Okay.
It really did have me in tears. I always say we never know where someone else's journey has came from. And just by looking at somebody, you can never tell what they've been through, because a lot of times God has helped them through what they've been through. And then on the outside, they shine, So tell us a little bit about your childhood.
Okay.
You were 13 years old. And what kind of childhood did you have before it led up to this incident that had happened?
So I was raised by both of my parents. Fortunate enough to have both my mom and dad still alive. In fact, they were just here this afternoon chatting me up before my interview, trying to calm my nerves. And they've been married, I think it's 34 years at this point.
Oh, wow.
So a long time. I've had some good teaching and some good genes that I've come from to be able to get to where I am. But really good, fortunate upbringing, because I was fortunate enough to have both of my grandmothers in my life early on. We're a very close-knit family. My mom comes from a large family, so does my dad. And so we're very close-knit. And so I was fortunate enough to have the family affair, if you will, plenty of family reunions growing up, all the love from community. But I come from a small town. So because I come from a small town, everybody knows everybody. So you really can't do much because everybody tells everybody what you're doing. So if you want to do anything, you got to get up out of town.
I think a lot of us grew up like that.
If you want to have any sense of anonymity, if you will, you got to run down the road a little bit. But it was great. Life was great. I had I was in the band, marching band, drum major in middle school, played trumpet, and was assistant drum major in high school. Went to college and cheered when I went to college, and was SGA president my last year. I've been very fortunate. Had a really good career. Had a really good career, but probably about the age of 18, 19, I started understanding that there was something different about me in terms of the people that I liked, people that I was attracted to. I think I had seen the attraction before then, but didn't really understand what I was seeing. And so I was playing house, so to speak, with folks, just trying to try stuff to see how it was going to work. But didn't really declare my bisexuality until I was 36 years old.
Yeah. Well, it takes us time to feel things out, So Did you ever date a woman?
I did. I had two fiancés along the way.
Did
I
you really?
sure did. I sure
Did
did.
you?
And I have to tell my girlfriends, my good girlfriends in particular, don't take me to the club and dance on me because I'm still a man who
Yeah.
likes women, even though I'm married to a man. Some things still grow when you touch them the wrong way.
Let's go.
Or I say the right way. So yeah,
Ain't that the
I'm
truth?
don't get it twisted. Just because I got a husband don't mean you can touch me and think I ain't gonna have a reaction.
Oh God, that's the truth. Now let's talk a little bit about 2009.
Okay.
Your diagnosis. And
Yes.
I read a little bit about how you went to the hospital with a fever and some pain. Talk a little bit about that, and then we'll talk about your organization and things like that after this.
Sounds good. So, fortunately, at the time that I was diagnosed, I was insured. I had just gotten a new job the month before in October with a telecom company, and on my first day, my insurance started. Over the course of the summer, however, I had been feeling a little ill. Nothing different than what I had experienced before, so I thought it was some of the same things that I had dealt with. And it just over the summer got worse and worse to the point that I couldn't swallow my own spit without it burning and hurting. I couldn't eat anything, really couldn't keep anything down. And so after this fortunate event of me getting insurance, having the background that I did, and my mom having worked in the medical field, I knew what kind of doctor to access. And so I looked literally by happenstance in the yellow pages and found this local infectious disease physician. And I thought, if something's wrong with me, I want to know everything that's wrong with me. And prior to that, had been being tested for HIV since I was 21. Didn't have a positive confirmatory in several cases. Had a false positive twice, but the confirmatories never came back. Well, of course, we know based on the information we have before us now, I had been HIV positive for a number of years because you don't get AIDS overnight, right? And so the day that I accessed my physician in October, he gave me some antibiotics, sent me home, did the HIV test, and at the time we had to wait 2 weeks for the results. So I was in that 14 day window waiting period for confirmation. And the day that I went back to his office on November 2nd was when I got the confirmatory. But I didn't get the confirmatory in his office. I got it in the emergency room. Because when I got to his office that day, my fever was 101.9 initially. He then wanted to send me to a GI, which was across the complex from where his office was, to do a upper GI exam to see what was going on. But by the time I got there, my temperature had gotten to 103. And so they wanted to rush me to the hospital. But me being the anal person that I am about appearance, and at this point, I'm thinking, I'm 33 years old. I ain't nowhere in the world I'm, going to the hospital. And folks gonna see my ass hanging out while I'm walking down the hall. Never mind at the time, I'm not concerned about my life. I'm concerned about folks getting my ass in the back of that gown. So I was like, look, I'll go back to my hotel, get me an overnight bag so I can have me some pants on up under my gown, and I will drive myself. Which at the time did not understand that I really was not only harming myself in the process, but I could potentially have harmed other folk. Because who knew that at 103 fever, you were really not supposed to be even aware that you're here. Because that's a high grade temperature. But I did. I drove myself to the hospital emergency room, parked my little gray Saturn at the time I was driving a Saturn, parked in the parking lot, walked in, got the triage as normal. And they literally, when they took my temperature, started panicking because they couldn't figure out what and how I had walked in the door, filled out paperwork and all those things.
Was the temperature that high?
Because of the temperature being so high. And so I don't remember from the time that all began until the time I woke up. I was in a hospital room with my provider and several other physicians at the foot of my bed telling me that I was HIV positive and that I had AIDS and that I had a life expectancy at the time of 8 days. And I looked at them and I said, interestingly enough, I appreciate the medical information that you said, but this is an answer to a journey that I've been on for 5 years now. I call it my wilderness journey because I knew in ministry that I was not a pulpit preacher. that never felt comfortable for me, even though I was gifted to do it. It was not where I knew I was supposed to be. And so I was on that journey, having traveled several states over the 5 years and lived and done different kinds of work. But on that day, it was crystal clear to me that I was born for this, that literally this was my passion, not only my passion, but it was my calling. I was supposed to be a voice for people living with HIV who couldn't voice their diagnosis, and that I was going to be a change agent for people to see that you can thrive and live beyond a grim diagnosis. And so I've done that. 1 year after the date of diagnosis, I went back for a follow-up with my provider, and he took me to a room in his private office, and he showed me pictures of all of his former patients whom he had lost. And he said, "This is the reason that I get up every day and come into this office to do what I do. You're the first person that will not go up on that wall with everybody else." And for that reason, we at the foundation have named a research fellowship after him, because he saved my life on this side. And the best gift I could give him was something that would be a legacy beyond his years.
That's a beautiful journey.
Mhm.
Beautiful journey. And you never had, when they gave you that diagnosis,
Mhm.
you didn't cry, you
Nope.
didn't flinch, you didn't scream.
Only thing I did, I said, "Can I call my mama?"
Mm.
And I called my mom because my mother was not there at the time, and I was in Atlanta, a suburb of Atlanta. I called my mother. Again, part of this I don't remember because I was sedated under many things. So some of these details my mom have had to tell me over time. And in the near future, people will be able to read all those details in a book that I'm in the process of writing.
Okay.
But she showed up at some point, and I do remember when she walked in the door, my mother dropped her head and she started crying, and she left. Broke my heart because my mother has never left me, especially in dire situations.
Mm.
I didn't learn until many, many years later that the reason my mother left me was because she went to fire some of the medical professionals who gave me up long before they thought they could take care of me.
Oh, wow.
So that story came to me as I was presenting in a national
Helping her
conference.
baby, that's what she was doing.
She was.
And the
He
baby
said, if you ain't got the will to do what you can do, and you ain't got the faith to know that he can overcome, you don't need to be taking care of him in this room. So she went to work. She did what a mama would do.
Work.
She went to work.
All right, mama. I need a mama like that. Let's talk about the your organization.
Okay.
Is it 652 Project?
Yeah, it's the 652. It's the 652 Project Foundation. No, it's not.
Named it.
It's not a Bible verse. Many people look at it and think it's a Bible verse. It's actually time. It's the time that I was born. And I didn't even know when I was born until this all unfolded. Had never looked at my birth certificate to see the time of day or any of that. But I was in the hospital writing literally the charter for this organization based on the experience that I had had in years prior for work that I had done in nonprofit, the nonprofit sector. And my mother said, "I don't know what time you were born." I said, "You need to find out." I said, "It's critical to missing pieces of this puzzle of what we're in this room doing now." And so when I found out the time, it was 13 added up, which is a phenomenal number in faith. And I said, that's it. That's what it's all about. It's the 652 Project Foundation. And so when I convened my board of directors a couple months after that, they initially said, "Let's name it after you." I said, "You're doing that. If you name it by the time that I'm born, you've still named it after me." So my birthday is every morning at 6:52 in the morning.
Oh, I love it.
Yep.
Your birthday is every morning at 6:52.
At 6:52. And I make it a point every morning to be awake for my new birthday.
Yeah, I love that. I love that. Now, talk to me about the organization and what it entails and who is it for? Let's talk about that because we're calling this the voices of blacks and women. So talk to me about
Absolutely.
your organization.
So when I started the organization initially, we only serviced the Tri-County area near where I was actually born. And it was solely to support organizations that were doing HIV work. Our whole mission is to support individuals, organizations, and companies who have an HIV focus. And after our third year, we went statewide, and after our fifth year, we went global. And up until recently, our primary focus had been nothing but HIV related causes to inform the public, to educate communities, to work with organizations about making sure that they were inclusive when it came to people living with HIV in their organizational structures
Mhm.
and all the like. And so you fast forward to 5 years ago, um, I started a sister organization called Kneel Together, spelled NEAL, stands for Northeast Alabama Together, and it is an LGBTQIA plus support group exclusively to people who identify in that community, where we support programs for LGBTQ youth and adults. We also do cultural humility and fluidity training around the subject matter. And we actually focus on making sure that we advocate on a state and federal level for equity and inclusion for all people.
Hmm.
And so when I started initially, our initial age range was 15 people 15 to 29 that we were focused on because it was within the age range of when I felt I contracted HIV. But we have since obviously done away with the age dynamic, and we're open to educating and informing everyone because it affects everyone. And so, particularly when you talk about elevating the voices of Blacks and women, because of the women that have been major influences in my life, I am a feminist and have always felt like women were the stronger of the two walking mammals that we have with two legs. Um, but I say that not to discount anyone of gender nonconforming um, identities, but because I was reared around a rich population of women. My
I want
father was
to
all,
ask you that is because
yeah, my father was always around, but I clinged to the women in my life. The women that I was around. I always wanted to learn how to cook. I always wanted to look cute. I always, all the things that we stereotype women for were things that I was drawn to, and particularly because I had an interest in the arts. And so as I moved forward with the organization, I would have been derelict not to have a focus specifically on Black women in the work that we were going to be doing, and Black young Black girls.
and then so uh, your organization, it's an organization for all individuals, but you focus
Absolutely.
mostly on women.
We focus on Black gay men, gay and bisexual men, and women.
And women.
We have specific programs for women, and we have specific programs for Black gay men. We've written curriculums in both sectors of the population. So we're always looking for partnership opportunities that focus on those two particular populations. However, we don't exclude anyone. If someone can build a case for why our support is needed, we figure out a way to do it. If it's not us, then we try to link them with a partner that we may have that potentially could help them.
Okay, and then you being in the South,
Hmm.
let me ask you this question. I ask a lot of people this question in the South.
Hmm.
Why do you feel that the rate of HIV diagnosis is so high in the South? And the reason why I say this is because I'm going to talk about Atlanta really quick. I was doing a project. I've been doing a project now for about a month. And
Hmm.
I looked at, I can't even count, maybe not even on two hands, how many HIV organizations for gay Black men in
Hmm.
Atlanta.
Mm-hmm.
So they have all these organizations. Why do you feel the rate of HIV diagnosis is so high? Is it because they're not doing the work? Or, I mean, I need this, I asked this question. It's something that I really feel that I like to get different answers to see, what someone else thinks about it.
Well, the question itself is loaded, right? Because it's not one answer. It depends on exactly what state you're talking about in the South. And then from there, you can drill down, very specific things. Alabama, I'll speak to because that's where we're corporately housed. We have not expanded Medicaid. We're a very rural state. We're also a Christian-based, faith-based state. And most of our state is rural. And so there's not transportation. There are barriers to care that people will have out the gate that they just unfortunately can't overcome in some cases. Our literacy rate's low, so people and messages that they receive don't always necessarily filter down in a way that they can understand. And so we know that there are a myriad of reasons why the HIV rate of infection is high. I will go back to the Tuskegee experiment, for example, that happened right in Alabama. There's medical mistrust, particularly when we receive messages. The messenger does not look like us more often than not. The message is crafted for a different ethnicity, and then we're expected to just embrace it as truth. When a lot of times, the very things that work for other ethnicities don't necessarily work for Black folk. We know with COVID, we're inextricably affected by COVID in ways that other people are not, particularly because of underlying medical conditions that exist or pre-existing conditions that exist. So because we have obesity, we have diabetes, we have, hypertension, we have all these other measures that are already affecting our communities because of our lack of access to healthcare and our mistrust around even accessing healthcare when we know we're sick. All of that exacerbated together, I think, is part and parcel as to why we have higher rates of infection. And then, those of us who are in the field, it's incumbent upon us to have more open, honest dialogue, right? And stop, I think, hiding behind titles and shields associated with stigma. And that's why when I was diagnosed, immediately I knew my role was going to have to be open, honest, and straightforward with folks. Because if I didn't capture the narrative, one was going to be created for me. Yep. And nobody can tell my story better than I can tell it.
Oh, that's the truth. No one can tell none of our stories better than we can. So how can we tackle these barriers? And how can you tackle the barriers?
Well, I'll tell you, one day at a time is the most honest answer I can give you, because no 2 days are alike. Our tagline for the organization is making a difference for tomorrow's world today. Oftentimes we get ahead of ourselves. We're working towards what we can do tomorrow, but some of us don't know if we'll ever see tomorrow. So what are we going to do today that can make a difference for tomorrow?
Always.
Right? Because all we know we have now is today. So in this moment, what we try to do is collaborate as often as we can, support people where we can, and be a voice where we can, where people can't. I'm fortunate that I have had the ability to do legislation advocacy on the state and federal level. I think it's incumbent upon all of us to get to know our legislative officials. If we've ever known importance of voting, 2020 has taught us that. If it never taught us anything else.
Yes, it has.
Because we're right now in a critical point where we have a new administration who actually does understand the effects of the HIV epidemic, and one that we're currently under. Until it was election time, we didn't even have an office of HIV open for people to be able to go to Washington, D.C. to do advocacy work, to try to talk to our lawmakers. And so we just know that every day that we get up, whatever the mission is that we see before us, that's what we try to do, to support who we can, how we can, where we can. If it's our voice, if it's our money, if it's our time.
So what do you need? I don't know, so to speak, what I would say need, but as far as your organization, how can people reach you? What do you need from other individuals? And don't you have some kind of a speakers bureau as well,
Yeah,
right?
yeah. So that's the newest addition to our family. So people can, as they can see online right now, I see you've got our website up. You can go to warrendates.com. If individuals are interested in donating, they can certainly do so by hitting our donate button. We welcome funds. No, none are too small, but we like gifts that end in 652. So you can do $6.52, or you can make it as you can do $6,520 if you want to. We'll be okay with that too. But so that's one way of doing it. And then other people can follow us. Follow us on social media. My personal handle is @WarrenDate or @WDate76 on Instagram. I'm at the 652 Project on Twitter. And then I'm Warren A. O'Mara Dates on LinkedIn. But they can connect through our website, and any questions that they may have, they can send an email by virtue of that. And we'll be glad to reach out and help them as best we can with whatever path we need to take. But I'm so excited that you brought up our Speakers Bureau. And because when we talked about me coming on, the one thing that I said, I don't do well at bragging on myself. I don't really do well about talking about myself. And I appreciate the words of kindness that you gave me around my humility, because my mother instilled in me, right, that with privilege must come humility. And I have been fortunate in my life to have a lot of access to a lot of people and a lot of things, some of which I've not necessarily been a great steward of in the past, but I've learned from those lessons. And so that's why I think I exude the humility that I have, is because I've had it and I've lost it. And it ain't just been one time. So I don't forget from where I come, but I know now that I have a great gift that's been entrusted me. And so with that, I have to remain humble in order to keep doing the mission. And so I was fortunate back in July to have a team of individuals who believed in my work and believed in me and the foundation's work over the last 10 years, who agreed to join me in establishing a speakers bureau. And it's called 652 Project Speaks, a speaking bureau. And within that bureau, I have, including myself, 13 fantastic people from all walks of life. They are the epitome of all that we are as a foundation and an organization in terms of inclusion, from age to race to identity to orientation, you name it, we can claim it, right? Because I feel like the most inclusive world is one where we embrace the differences among us. And so we built the Bureau around making sure that we were all inclusive in all ways possible for our speakers. Yeah. And so, if people are interested in joining, there's still an opportunity to do so. We do a rolling basis
on your speakers bureau.
So if you want to become a speaker on our speakers bureau, there is a process that you would go through to join. I have sole discretion, obviously, to let folk in or not, particularly because of the people that we have involved. We have to protect their brands as well. But I have nurse practitioners who are a part of the bureau that are providers in the HIV world. I have a researcher who's done HIV data in our bureau. I've got social media gurus who are also IT techs that are a part of our bureau. I'm fortunate to have my brother as one of my speakers, who is a social and digital influencer all his own. We've got curriculum writers, authors of curriculum that have co-authored with me. We've got educators from, with master's degrees. So we've got the gamut. I've even got a licensed therapist on the bureau. So we've got a full gamut of service that we can offer. Now, we don't provide medical services, but we do provide medical training, and we do provide the trainings associated with the subject matters that we tackle. And those, again, when you go to our website, if you go to 652 Project Speaks on our speaker tab, then you can find out all about who those individuals are, as well as the subject matters that we tackle as part of our trainings that we do.
Okay. You know what? I thought this was going to be a little bit longer. But you rolled it all up in one. Used the right words, said what you needed to say. We're like, we out of here.
Oh, wow.
No, I think it's good to have, this is how I feel, to have Black folks with their own organizations and helping the community. Not just Black folks, but all, being inclusive for all. There have been times where I've asked the question, why aren't you being inclusive? You can't say something is for Blacks and then you only talk about Black women, or something is for Blacks and then you only talk about Black men, or you only talk about gay Black men. The word Blacks means everyone.
It's universal.
And I've had an issue with that a few times in a lot of these conversations or Zooms that have been going on. And someone got upset when I asked that question. But the title said Blacks. But you weren't talking about all Blacks.
Right.
So I thank you for that. And I'm going to have you on again with your speakers. That's what we're going to do.
Yeah. They're excited to be able to share their knowledge with your audience. So we're excited about this new partnership that we've been able to forge. People need to know that we're now partners. We will be promoting Positively Dee as much as she will be promoting us. And so we're excited to be walking into 2021 with you. And I'm excited to announce tonight on your show that I will be co-hosting my own radio show starting in January.
Yeah.
The name of the show is going to be Got to Be Real with Warren and Mark. Mark is my co-host, and we will be hosting twice a month starting in January. We've got a lot of great things happening at the 652 Project Foundation right now, a couple of which I can't talk about for legal reasons, but 2021 people need to get ready because it's going to be a lot of stuff coming on in 2021.
Yay!
We want folks to know that we're here, we hear them, and we're in the process of responding to the need.
Anybody have any questions for Warren? You can type them in, and can you see the chat, Warren?
I can see it. Yeah, I can see people as they're making commentary over to the side.
If you guys have a question, you can go ahead and ask. I can't wait for it to start. And it's going to start on YouTube, or how is that going to work?
We haven't decided if we're doing the YouTube and podcast as yet, but the platform will be one that people can stream either way. It won't be a charge initially. We're working out the details of sponsorship at this point, but we want people to have access to information. And so we will be providing a service through the program, not expecting people to subscribe to pay for it.
Nice. That's the only way they're going to get the information.
Exactly.
That's the only way they're going to get the education.
Exactly.
So
it's going to be, we're calling it Fun and Facts. So it's going to be some cut up in the midst of us giving some great information, but it's going to be a situation where each month we will deal with an issue relative to the things that we do at the 652 Project Foundation. I do see a question, so I'm going to address that. The question is, for those who may not see the chat, is talk more about what the radio show will do and what it'll be about. And so the radio program will be about subject matter relative to what we do at the 652 Project Foundation, a lot of which will be HIV related. A lot of it will be LGBTQIA plus related. A lot of it will be women's and girls' issues related. And there will be some social justice conversations that we will have. And it will be some very hard conversations for some folk, because we have people who not always agree with each other at the Bureau, but we can agree to disagree and work together still in the same. And we think that that's the equation that's going to get us in this world place to become a more inclusive place to live, is when we can understand that we're not all the same, but we can cohabitate, we can hear each other, we can listen to each other, and we can get along all at the same time. So we're going to bring to you what we're trying to give to you in practice through our radio program.
Yeah, I can't wait to watch it.
Mm-hmm.
I can't wait to watch it and share it.
We can't wait for you to do that. And hey, we'll return the favor. We'll have you on as a guest as well.
All right. Hey, Benita.
Hey, Benita. Hey, BB.
We're about to get off of here. So, you guys go to warrendates.com. warrendates.com. Check out his website. And I want you guys to check out that YouTube video. That's part of the
So Dee, if you would share the video on your page, you have my permission to do that. I think it's a great 3 minutes of why I do what I do. It'll help people understand the nature of who I am if they've not ever met me. And someone just asked the question, am I coming out with my own line of glasses?
Right. Because you'll be wearing a Warren.
We'll see. Again, there's a lot of new things coming in 2021, some of which I can't talk about right now. So just stay tuned, Deidre. Just stay tuned.
Right. Let me put this in here. Maria, I'm putting the website here in the chat. I hope you can see it. Go ahead and click it, and it should take you to the site. And then where can you be found on Twitter and your other social media channels?
So my Twitter handle is at the THE652 project. And my Instagram handle is at WDates76. And on Facebook, for those of you who've been getting these random requests, yes, I'm back in Facebook land. And I'm now Warren A. O'Mara Dates on Facebook. And that's spelled O''M EARA -DATES.
You guys got that? I hope you got that. Maria says thank you. Warren, always ask, at the end of the show, a lot of times to give some uplifting, positive, sane, or some words of encouragement for people that are watching.
I thought that you might say that to me. I don't try to preempt videos or interviews. I generally ask my interviewers not to give me their questions in advance because I want people to know my heart.
He didn't want questions either.
I think the only way to be able to do that authentically is to truly speak from your heart. And so I'm going to do that. I know many of you, and I'm going to look into the camera because I want to, for those of you who may be having a hard time, and I'm going to get emotional because I'm that person. When I can feel the pain and the energy, it comes across. And so I will say to you that despite what you may be feeling in this moment, deep within you, there is something greater than yourself, that if you just would be willing to tap into it with a couple of deep breaths and a little patience, you can make it. I made it. I'm still making it. Every day is not going to be easy, but you can make it and you can thrive, because what I do know is greater is he that is within us. And the he for me is my soul, than anything that we have to face in this world. So know that You're loved, you're seen, and I'm hugging and holding you from afar. Reach out to me on social media at any given time if you just need someone to talk to. A lot of my friends will tell you 2 or 3 o'clock in the morning, I'm working, I'm on social media, I'm talking, I'm helping. Never, never be alone because you don't have to be.
Thank you.
Thank you.
Thank you for coming on. And we're
All the
gonna
love.
sometime in December, maybe. Or the end of November. I don't know, but you coming back on with your speakers. That's what we're gonna do. That's what we're gonna do. So much love. So much love.
Thank you so much. I've enjoyed it.
Feel it.
I've enjoyed it.
All right, everybody. Say bye-bye to the amazing Warren on married dates. And we'll have him back on again. Go to warrendates.com, warrendates.com, check out his website. And I'm going to share the video. I'll put it on my show page on Positively Dee's discussion. I'll put it on there and you guys can take a look at it. So, all right, Warren. Much love to you.
Till next time.
Till next time. He has such a beautiful song. Such a beautiful, beautiful song. That's kind of bringing tears to my eyes. It really is. So I wrote something down for a positive word. And it says, we live in what we believe and what we think we are. We live in what we believe and what we think we are. And what that means is, if you believe and keep telling yourself that you're unhappy, or if you keep telling yourself that you're depressed, guess what's going to happen? You're going to continue to believe that. So if you change your mindset and the way that you think, because I've said that over and over again to so many of you, change your mindset. And it's going to change your mind and it's going to change your life. So let's put these in here. Go to preventionaccess.org. Preventionaccess.org, which is U equals U. Undetectable equals untransmittable. A person living with HIV who stays adherent to their medication, their HIV meds, becomes virally suppressed, which means undetectable. A person living with HIV can no longer transmit HIV to their partner when they become undetectable. U equals U is actually saving lives and is a liberating, very liberating to so many people who thought and felt that they were infectious. U equals U is actually helping individuals rush to get back into care. Those who are out here. I want to also tell you, if you are looking for the HIV criminalization laws in your state, go to the Center for HIV Law and Policy.org. HIV Law and Policy.org. They're based out of New York, but they can help you. HIV Law and Policy.org. If you are looking for an awesome online organization for women with many blogs and stories and articles on HIV, you can go to the Well Project, thewellproject.org, thewellproject.org. If you are looking for testing in your state, testing on HIV, STDs, it doesn't matter, just testing. Go to hiv.gov. hiv.gov, type in your city, state, or zip code, and it'll show you all those testing sites in your area. I want to give a shout out to a wonderful organization called Positive People Network, Inc.org. Positive People Network, Inc.org. It's an amazing, beautiful woman by the name of Alicia Tremere. And she takes her donations and she actually walks the streets in her community, buying food and packing lunches for the homeless. She takes the donations and she buys clothes for women who are looking for work so they can look their best while they're searching for employment. Alicia Trammell, another amazing, beautiful, strong woman who wants to make sure that her community is taken care of. You can go to Positive People Network Inc.org, positivepeoplenetwork.inc.org. All right, you guys, this is Positively Dee discussion. You have to remember that HIV still exists. You have to get tested. You have to use protection. Because if you have contracted HIV, guess what? You can get on medication and you can live a better, healthier, beautiful life. I'll see you next week. My next guest will be a doctor by the name of Oni, O-N-I, and a young man by the name of Reggie. We will talk about Blacks in the community, HIV, U equals U, and how we can help together as one. Love you. Have a happy day.